Lissy College of Pharmacy, and Honorary Secretary of IPA Kerala State Branch to deliver the welcome address. Over to John Joseph, sir.
Yes, thank you, Dr. Julie. First of all, let me also welcome you as the Master of Ceremonies. And I'm very happy, a very pleasant evening to all of you. And may I wish everyone Eid Mubarak. As we all know, the experience or the exposure of the pharmacy students in Kerala, especially to the industry, is not very heartening. That's why Indian Pharmaceutical Association Kerala State Branch has undertaken this program of giving an insight to all the students who are interested in industry. And this program, which is the fourth one in the series, is being inaugurated today. We have a host of dignitaries, eminent personalities to honor us with their knowledge. So at the outset, let me welcome all of you, especially our President, Dr. P. Jayashekhar, who is the initiator of these programs. So wholeheartedly, let me welcome Dr. Jayashekhar, the President of this function, to this evening. We have Dr. Mohanan Kundamal, Honorable Vice Chancellor of Kerala University of Health Sciences, who will be inaugurating this session. Sir has been very helpful to us. And as far as students are concerned, he is an eminent person who guides them. And in the past also, Sir has been involved in many activities of IPA. And we are blessed to have you here, sir. And wholeheartedly, let me welcome you, Dr. Mohanan Kundamal, to this evening's function. Another stalwart with a wide experience in industry and in pharma, Dr. Ajit Singh, Chairman of ACG Worldwide. I'm sure his experience will be a big boost to all the students and all the participants today. Let me extend a warm welcome to you, sir, Dr. Ajit Singh. Thank you for being with us. Another eminent personality who is very much involved in the activities of IPA, especially he has been a tremendous support to us, Dr. Jayashilan, Chairman of IDMA Tamil Nadu and MD Delvin Formulations. Sir's experience in industry, being an entrepreneur, is immense, and the words which we'll share today will be a real motivation to all the participants, especially the students. You'll know how you can become an entrepreneur as well as a good industry man. So let me welcome you, Dr. Jayashilan sir, to this evening. We also have E.A. Subramaniam sir, chairman of KSDP. After he has taken over as the chairman, the progress of KSDP is immense. And he's been very, very helpful to us in guiding not only our students, even the teachers. Just now, we have concluded a hands-on training program for the teachers. About 13 teachers from various colleges has undergone a week's hands-on training in KSDPA. And I'm very happy and thankful to Subramanian sir for organizing and helping us in this venture. Hearty welcome, sir. This is Santosh Dr, who is also the senior manager of KSDP. He was also engaged and always helping us in training the students. Welcome you, sir. Mr. Prabhakaran, a secretary of Kerala Pharmaceutical Manufacturers Association, a young and dynamic personality. His guidance will be a valuable support to all of us. Welcome, sir. We also have Mr. Aju Mohan, who will be delivering the vote of thanks, Mr. P.K. Harikumar, convener of the IPA Industrial Forum. Welcome, sir. I also like to welcome all the stalwarts from the industry, and also a big welcome to the participants, those who have undergone this training, hands-on training, Mr. Vikash, Vice and Ms. Steffi, who will be sharing their experience in their training program. Let me also welcome all the teachers, the faculty members, the committee members, and all the resource persons to this evening. Once again, I welcome each and every one of you, especially all the participants, dear students. After this series, I'm sure you'll be delighted about the opportunities, knowing about the opportunities you have in the industry. So once again, I wish you all a warm and pleasant evening and welcome one and all. Thank you very much.
Thank you, sir, for your warm welcome. Now I invite the President of IPA Kerala State Branch, Dr. P. Jayashekhar, to deliver the presidential address. Over to you, sir.
Thank you, Dr. Julie. Good evening to one and all, and warm greetings on the occasion of on Eid, and Eid Mubarak to all of us. Let us hope today's deliberation will be an eye-opener for the students as well as the members of the professionals who are joined here. Chief guest of the inaugural ceremony, Dr. Mohammad Kundamel, Honorable Vice Chancellor of Kerala University of Health Science, Mr. Ajit Singh, Chairman, ACG Worldwide and veteran pharma industrialist, keynote speaker, and also keynote speaker for today's function. Distinguished guest, Sri Jay Sheelan, Chairman of IDMA State Board, as well as MD Delvin Formulations, Chennai, Sri E.S. Subramaniam, MD KSTP, Mr. Prabhakaran, Mr. Purushothaman, they are office bearers of Kerala Pharmaceutical Manufacturers Association, Mr. John Joseph, Honorary Secretary of IPA, Mr. P.K. Harikumar, Mr. Sandosh, Mr. Aju Mohan, who are Industry Forum, and distinguished invitees from industry, especially who are the backbone of Orientation Pharmacy Program. Pharma industry are Mr. Suresh Kamath, Mr. Vanjinathan, Mr. Vinupal. They are the three important persons who helped us in molding the Orientation Pharma Industry Program. And distinguished invitees from industry, dear fellow pharmacists, esteemed faculty members, and dear student participants. Indeed, it's a proud moment for all of us to witness the curtain raiser of fourth edition of Orientation Pharma Industry, a webinar series in 2025. Coming back, India is known as a pharmacy of the world. We produce quality medicines at an affordable cost. However, there is a setback, a backwardness of pharma industry in Kerala due to various reasons. Therefore, our students are not getting exposed to the pharma industry, though they study a lot of pharmaceutical courses. Therefore, students were not showing any interest to getting into pharma career as they are not getting exposed to the training or such things. Knowing this fact, the Industry Forum of IPA in 2021 and 22 decided to organize some activity, especially orientation to pharma industry. And we sought help from Mr. Suresh Chandra, former senior executive of NATCO Pharma, Mr. Vinupal KK, is the director of Solista Pharmaceutical Pondicherry, Mr. Vanjinathan, who is also senior vice president of Fruits India. These three people helped us in Kerala State Branch to formulate a module, a series of modules for the benefit of students who are aspiring for the pharma industry. And the webinar series consists of nearly about 18 modules to expose various intricacies of pharma industry. This year, students were nominated from various colleges. 120 students registered, and they underwent 1 month hands-on training in various deputed pharma industries, Kerala, Bangalore, and Chennai before starting the webinar. And we are starting the webinar series from next week. The training program offers an ideal opportunity for students to gain conceptual as well as practical aspect of pharma industry. We are much grateful to dedicated subject experts from industry who really readily accepted the invitation to be part of the webinar series. We appreciate the generous approach as well as support of pharma firms in permitting our students to undergo 1 month training or internship. The role of Kerala State Drugs and Pharmaceutical in grooming our students is worth commending on. IPA Kerala State branch is worried about the withering pharma industries in Kerala, though we are the biggest consumer state for medicines. The strong socio-economic and political support is a need of the hour, and we have to create an investor-friendly industrial state. In the present scenario, pharmaceutical industry could be set on a public-private partnership to manufacture essential medicines, including large volume parenterals, nutraceuticals, cosmetics, and medical devices, etc. Let us work together to promote pharmaceutical industry like our neighboring states. We have Mr. Jay Shilan is already here, sir. He is already a icon for this startup companies in especially pharma part. We have to attract realistic technoparks, technos, and entrepreneurs and investors to start pharma business culture in Kerala, and we have to copy the successful models from other states. Let us create manpower for training our graduates for future needs. We congratulate the students who joined for OPI 2025. And dear students, it's a golden opportunity to learn more about the industry right from the industry experts. Try to attend all the sessions, make sessions more interactive by asking doubts and clarifications. Indeed, IPI is much thankful to respected Vice Chancellor of Kerala Health Science University, Mohammed Kundammel, a visionary health science educator as well as leader, for gracing this ceremony and inaugurating the function. We have a suggestion to Vice Chancellor to revamp the pharmacy curriculum to have more scope for pharmacy industry collaboration. IPA is ready to support cohorts in industry collaboration for training and research. We are fortunate to have Sri Ajit Singh, Chairman of ACG Worldwide, a veteran global pharma industrialist, as a leader, as a chief guest and keynote speaker. In tune with the technology, he is actually a technocrat. He is in tune with the technology development. ACG has developed automation as well as AI applications in a manufacturing process in most of the pharmaceutical units of ACG. We are proud to have Sri Ajit Singh here, and his wisdom will be shared today with our students as well as our members, so that we can think rightly about how the future of pharma industry in Kerala can be shaped. The professional message from Sri Jay Shilan and Mr. Subramaniam will be boon for the participants. Listening the words of such stalwarts from the premier pharma industries will boost their morale to think positively for a pharma business-friendly state. We are much thankful to principals and faculty members for encouraging students to join the program. Fortunately, we have a team of industry experts as resource person and dedicated pharmacy faculty to coordinate and administer the webinar series. We seek your support, guidance, and blessings for the success of unique training program administered in Kerala for the students of pharmacy. We are optimistic that students will develop a positive mindset for their industrial career. With utmost humility and proud privilege, on behalf of Indian Pharmaceutical Association Kerala State Branch, I once again thank you all for unconditional support and encouragement. We are blessed due to your presence, and let us groom the next generation of pharma experts, and let us be an initiative. Stay blessed. Have a pleasant evening. Thank you. Jai Hind. Namaste.
Thank you, sir. To give us an overview of certified webinar series, may I now invite Mr. P.K. Harikumar, convener of Industry Forum and former senior manager at KSTP Limited. Over to Harikumar, sir.
Thank you, Dr. Julie. Good evening to one and all, and greetings of Eid Mubarak. Respected Chief Guest, Dr. Mohan Kundumel, Honorable VC, Kerala Health University, and who is to be inaugurated this function. Mr. Ajit Singh, Chairman, ACG Associates. Guest of honors Sri Jayashilan, MD Davan Pharmaceuticals, and Sri E.A. Subramaniam, MD KSDP Limited, and our vibrant President IPA Dr. Jayashekhar, General Secretary Dr. John Joseph, and other speakers, faculties, coordinators, resource persons, fellow professionals, and dear students, participants of OPI 2025. This is the fourth OPI program, and we have started, as earlier said, in 2021-22. This webinar series is envisaged to equip and attract the professionals to pharma industry, and along with the hands-on training, which was included from the second series. From last year onwards, we have started faculty training program. As earlier said by our secretary, that we are deeply indebted to Sri E.A. Subramaniam, MD KSDP, and the team headed by Mr. Santosh, Senior Manager KSDP, for the acceptance and well designing and implementation of hands-on training and for faculties and students. We are thankful to our industry from Kerala and outside Kerala for giving this opportunity to our students. After today's inauguration function, the webinar series is going to start on 14th June, Saturday. We have participants who completed 6th semester and now doing 7th semester B.Pharm, and those students who are completed 8th semester examinations. We have arranged 19 modules in this webinar series by industrial experts from all over India and abroad on various intricacies of pharma industry, like overview of pharma industry and manufacturing operations of various formulations, research and development, designing, marketing, QA, QC, and all the fields in the pharma industry, with a special emphasis to AI. The classes are conducting on Saturdays and Sundays at 7:30 p.m. This certified webinar series carry pre-test, which includes 5 MCQs, and post-test 10 MCQs. The credit points in this certificate depends on the attendance and grade in the assessments. Make use of this wonderful opportunity and interact with the pharma experts to know more. For the effective and successful completion of this webinar series, more than 25 adjunct faculties as moderators and assessors, institutional coordinators of more than 10 institute persons as working hard behind this program. Looking forward for a fruitful interactive webinar series. Best wishes. Thank you.
Thank you, sir. Now we will hear about the hands-on training initiatives from Mr. Santosh Tia, Senior Manager Technical KSDB Limited, Alappuzha. Over to Santosh, sir.
Thank you, Julie Madam. Am I audible?
Yes, sir, you are audible.
Thank you. Good evening, ladies and gentlemen. Respected IPA President, Kerala State Bank, Dr. P. Jayashekhar sir. Respected Dr. Mohan Kundumel sir, Vice Chancellor, KUHS. Dr. Ajit Singh sir, Dr. John Joseph sir, Jayashilan sir, Subramanian sir, MD KSDP. Respected members of IPA and dear students. I am pleased to present the report on hands-on training as part of OPA program organized by the Indian Pharmaceutical Association Industry Forum Kerala in 2025. In this year, nearly 121 students from various colleges of KUHS registered for orientation of pharmaceutical industry program in 2025. The principal objective of this training program are to impart industry orientation training, knowledge to the students of pharmacy aspiring to build their careers in pharmaceutical industry. The program also caters to the needs of pharmaceutical companies, having candidates motivated and they are exposed to various intricacies of dynamic pharmaceutical industry and business. 1 month hands-on training was offered to the premier industries in Kerala, Bangalore, and Chennai that covers various facts of manufacturing and business like research and development, formulation of dosage forms, manufacturing techniques, quality control, regulatory affairs, and marketing management. The major number of students done the training in KSDPL Alappuzha, a public sector drug manufacturing unit under the government of Kerala. These training programs are organized and well executed, and the students are exposed to various production operations, different dosage forms, equipment for the manufacturing, quality control, quality assurance, marketing, etc. And they are prepared a training report also. This year, the major companies opted for hands-on training in Kerala. The main companies are KSDP Alappuzha, Sans Laboratories Pala, then Variety Pharmaceuticals Shornoor. From Bangalore, Mylan Pharmaceuticals Bangalore, Microlabs, Steriscience, Sami Sabinza Group, KAPL, Himalaya Wellness. From Chennai, it is Saimir Innofarm, Delvin Formulations, and Fords India, Chennai. Upon the successful completion of the training, the students were given the training certificates from the firms. So this year also, we are hoping for a better training program, and all the students can make use of this great opportunity. Wishing you all the best. Thank
Thank you, sir. Am I audible to you all?
Yes, yes.
Okay, fine.
Over to Julie, madam.
Okay. So our OPA 2025, it will be inaugurated shortly by our Honorable Vice Chancellor of Kerala University of Health Sciences as he is traveling. Now we will hear from our chief guest, Dr. Ajay Singh. So let me give a brief introduction to Dr. Ajit Singh. Dr. Ajit Singh is the chairman of ACG Worldwide, Asia's leading manufacturer of pharmaceutical capsules, machinery and packaging systems. Educated at Millfield School of and Cambridge University, UK and Harvard Business School, USA, Dr. Singh has led ACG to global acclaim, including the Lighthouse Award from World Economic Forum for Technological Innovation. He has also served in leadership roles across major pharma associations promoting innovation and quality. We are honored to invite Dr. Ajit Singh to address the gathering. Over to you, sir.
You are muted, sir. You are muted. Okay.
No.
Okay. Yeah, you say now it's
Okay.
okay.
Okay now?
Okay, now, sir.
Right. Okay, thank you. So thank you for having me here. I'm
Yeah.
really honored to be with so many dignitaries in your state. I love Kerala. It is for me truly God's own country and my country. I have many people from Kerala working in our group in India and some overseas. And therefore, I do not easily accept the reason I heard earlier today that because there is no pharma industry in Kerala to any extent, therefore our pharmacy students don't know what to do and how to be ready for for in industry work. Now, look, this is not so. I know if we were talking to students in Kashmir or in somewhere in the Northeast, it's really difficult to find industry to go to because there's none in our state as well. But if you look at the map of India, just dotted around India in all a big semicircle are areas of India where there is thriving pharma industry. It's only a few hours away. So to your north, you have Goa, 60 to 80 good pharmaceutical companies. You have Hyderabad, which is virtually the drug capital of the world. You have Bangalore, and I can go on and on. So there is no problem in Kerala students seeking entrance into these companies. I think students from Kerala are at a premium. Kerala people are known to be hardworking, sincere, absolutely honest, and have made a success in whatever fields that they've got into. I look forward always to having somebody from Kerala in my company, and this includes many pharmacists. Now, I also hear that industry readiness is something required in our pharmacy colleges, and therefore, this whole series of admirable lecture programs that have been arranged by the IPA in Kerala. If you talk to the government of India, particularly those responsible for the pharmaceutical industry, they also seem to have this cry, this plaint that the pharmacy colleges do not make students industry ready. Now, I don't know why they say this, but just look at the incredible amount of work that the Kerala pharmacy colleges are doing. And this is true across India. I see there are 4,000 pharmacy colleges in India, I'm told, and I'd say at least one third to half are running programs to make their students more industry ready. Besides looking outside Kerala within India for jobs in the pharma industry, let me also lead you to consider what a great impact and how many Kerala nurses there are in all the English speaking countries of the world. Nurses run through a training program as rigorous as that is pharmacists, and yet they find their way around the world. Most hospitals around the world have pharmacy, have hospital pharmacy, but more important than that, many of them are beginning to make individualized medicines. If you make individualized medicine in a hospital, you need pharmacists. So I can assure you, if you look around, you'll find many hospitals around the English-speaking world today are looking for pharmacists. And pharmacists in America, Europe, Australia, they are not trained to manufacture or supervise the manufacture of medicines. The pharmacy courses in these westernized countries train pharmacists to join retail pharmacy. That's all. 90% go into retail pharmacy. So we in India, who are trained much more to understand industrial processes and medicines, have a big head start over them. Now, how do you manage to get hold of the contacts in America? Now, here's where your outplacement professor we could chat with him and explain how. I would find a way of going to the colleges of nursing in Kerala and find out where all these nurses are around the Western world. Almost all of them will be in hospitals. Then we should reach out to their national sentiment and Kerala sentiment, and we should say, please find out, are there not vacancies now in that hospital? And I'm almost sure if you arouse their national spirit, they will come back to you and they can be a conduit for the entry of hundreds of pharmacy graduates from Kerala into the Western world. Just try it. If you need my help, please let me know. I've got good relationships in several American and UK hospitals. Now, I'm not going to talk today to you about how to what the pharmacy industry gives you as a career because you know it very well. In fact, it's a truism to say that we don't understand the pharmaceutical industry, because the majority of students studying the pharmaceutical sciences throughout India find their careers in the pharmaceutical industry. So we already know about the pharmaceutical industry. So I'd rather talk to you about other opportunities that you have, and also within the pharma industry, what you could look for to further your career, not just to join the industry, but to do well in that industry. I have always been a great believer that I am not very enamored with students who get a very high quality degree, who come first class first. And I'm a little bit of the Japanese in this regard. I feel if I hire somebody who's first class first in his university in pharmaceutical sciences, he will always feel that I should be grateful to him for giving him a job, because he could have got a job anywhere. Whereas I would rather take a student that's got a more modest degree, because he will work hard and he'll be grateful to have a job, and I can train him up to be the best of the best. Now, I know that the academia listening to me may or may not be very happy about this, but I'd be really glad if pharmacy colleges, like the rest of education in India, would breed leaders, champions, girls and boys who show how much more they can do, particularly leadership skills. This is what I look for to hire pharmacists in my country, in my company, and I think our HR also considers personality more important than marks. Now, that's I'm talking as a practicing industrialist, not as an academic. Now, what else could you be doing other than joining the pharma industry? Well, there are a number of scientific pursuits that require pharmacists. You may not have heard of it, and in order to get up to date with these um, opportunities, I would urge the Indian Pharmaceutical Association to join hands with a couple of organizations abroad that actually is fully aware of these opportunities and run training programs for them right through their career. These two associations, one is the American Association of Pharmaceutical Scientists, AAPS. The other is the FIP, or Federation International Pharmaceutic, which is the International Pharmaceutical Association. The first one has about 10,000 members, all of them from industry, mostly pharmacists, some chemical engineers, and so on. The second one is mostly pharmacists who are going into hospital pharmacy or retail pharmacy. So both are great opportunities for you, but only if the IPA joins hands with them and every year or two has a joint program with them, so that we get their best speakers coming to India to educate us all in the way that the world is going. So what else can the world offer pharmacists? Have you ever heard of military pharmacy? There's a big career in joining the armed forces, and they need pharmacists. They've got so many hospitals and pharmacy stores, as well as manufacture of some types or the other of various medicines in a small scale. Have you heard of nuclear pharmacy? Well, you know, in preparation for that horrible thought of some nuclear leakage from an atomic energy plant, or worse, there are pharmacists abroad who are trained only in what to do in case of a nuclear fallout. And this is something I'm sure if IPA goes to the government, creates vacancies through them for pharmacists, you'd have a really interesting and good career. You also then can look at other areas. You can look, for instance, at um, we can look, for instance, at emergency pharmacy. Now, this is another big area abroad where emergencies take place all the time, but there may be some doctors available, but there are not the pharmacists to do the pharmacist's job in an emergency situation. You also then have other areas which I won't go into, but I will talk to you to later. One area that you should consider really seriously is the whole area of patents. You can join the fraternity of patent experts by, after your pharmacy degree, you go for a 2-year legal law degree or 3-year, where you learn about patent law. Now, believe me, I'm in industry and I can see how much fierce competition there is between brilliant Indian companies and overseas companies who hold patents. And there is court case after court case going on about transgression of patents. Usually the judges and the other lawyers have to be trained that if there's a transgression of a pharmaceutical patent, what does it mean in scientific terms? And only a pharmacist can actually explain this to them and actually work out the case for the judge with strong proper pharmaceutical content. Now, there is going to be the biggest war in India for me in the future is going to be the patent wars. Hundreds of brilliant Indians are going to be involved and brilliant lawyers from abroad. But they're all legal people. They don't understand the science of what they're trying to portray to the judge. So please do consider a career in patent law, because the hundreds of millions of dollars that are spent in fighting these cases, when a small share of that, which is big money, will come to the legal company you're working for, and also as a as a leading practitioner of the law, hopefully also to come to you. So do consider these options, which generally we do not consider. Another area to look at, which is very interesting, is not just pharma companies, but companies that supply pharma companies. Not only bulk drugs. There are companies that supply machinery, capsules, packaging film, glass bottles, syringes, and these pharma ancillary companies have very little knowledge of the pharmaceutical sciences. And that's actually becoming very dangerous today. If they don't understand the effect of medicine on the stainless steel that they're making for the pharmaceutical companies, if they don't understand the temperature and humidity effects, again, which affect medicine, which is being filled in their machines, you can really have a problem at the user end. And here is where pharmacists in the shop floor and in the administration of ancillary companies can really help both sides, the pharma industry and the ancillary industry. Now, when you join an ancillary company, let us say ours, where we make capsule filling machines, we're the largest capsule filling machine manufacturer in the world presently, and the second largest capsule manufacturer in the world. We now, in the last 15, 20 years, have understood the importance of having pharmacists in our production, in our lab, and also in our sales teams. And if a pharmacist joins a company like ours, or 500 other companies doing pharmaceutical ancillaries, what happens is they're one amongst many, or two amongst many. If you join a pharma company, you're one amongst hundreds. So you have no great specific advantage or respect in a pharma company because there's so many of you there. But working in an engineering company making products for pharma, you are respected. Your knowledge is rare, and what you say is listened to. Interestingly, also, in such a company which is supplying their products to hundreds of good pharmaceutical companies, you are given an opportunity to go out into the market and meet your customers. So over a period of a couple of years itself, you will meet 20 or 40 pharmaceutical companies. You will go into their R&D labs, into their stores. You will meet their administrative management. You will see their offices. You will see their factories. And you get a very good idea what is really the value of each company to you in the future if after 3 or 4 years you want to leave the ancillary company and join the pharma industry. Well, actually, they don't have to interview you. You, over the last 4 years, have already interviewed them. You know which are the companies you want to work for and join, and therefore you'll try your best to be of value to them and in their eye as you visit them as a supplier. Catch their attention. So I can go on and on today. There's a lot of exciting things happen. Pharma industry and ancillary industry is going absolutely to the top. It's an industry I have enjoyed working with almost all my life. I know I'm on the right track because they grow every year. We also grow every year. And the interesting thing is that in the pharmaceutical industry, 7 out of 10 of the top companies in India are headed by pharmacists. Please look up the names of the top companies. Look up the managing director or the managing partner. You'll see he's had a pharmacist background. There is no other country in the world where pharmacists run the biggest pharmaceutical companies. And this is an important reason why India is paramount. India controls 25% of the medicine supplied into the world. 4 out of 10 prescriptions made out in America by American doctors are filled with medicines supplied to the American public from India. So it is us, the colleges, the pharmacy colleges, who have trained our girls and boys to make proficient and good medicines who are responsible for the success of the Indian pharma industry. I might hardly tell you also that the pharmaceutical company heads are amongst 3 or 4 of them are amongst the richest in the country. So, in spite of all the problems that we have with regard to regulations in India, we still thrive on challenge and we reach the very top. Therefore, please take advantage of your position now. Remember that your personality development is as important to me as the marks you get. Remember that you can find a job abroad through these suggestions I have made to you. Also, do not forget there are other avenues available to you to service the pharma industry with your pharmacy degree, and those are in the areas I mentioned to you, including ancillaries such as mine. So thank you so much for listening to me. It's been a pleasure talking to you. I hope I get a chance to do so again in the coming years. Thank you.
Thank you.
Thank you, Dr. Singh, for your very informative and guiding address for the career aspirants in pharmaceutical industry field. So now they got an idea that career opportunities are not limited to traditional industry fields, but also this like patent field and also like ancillary industries and many more. Thank you, sir.
Thank you. Thank you so much.
So now, it's my pleasure to welcome our guest of honor, Mr. Jayaseelan Jagannathan, a distinguished pharma entrepreneur and leader. An alumnus of Madras Medical College and MBA holder, he has held leadership roles in Torrent Pharma, Eli Lilly, and RPG. He is the visionary founder behind Noor Chemicals, Delvin Formulations, and more. And currently, he serves as Chairman, IDMA, Tamil Nadu, Puducherry, and Kerala. He is also working as National Vice President, IPA Industry Division, President, Tamil Nadu State Pharmacy Council. And with all respect, may I now invite Mr. J. Jayaseelan to deliver his message. Over to you, sir.
A formal good evening to everyone. Respected President of IPA, Kerala State Board, Dr. B. Jayashekhar, the Chief Guest of today's evening, Dr. Ajit Singh, Chairman of ACG Worldwide, Dr. Mohan and Kannur, Vice Chancellor, Kerala University of Health Science, Mr. E. Subramanian, Managing Director of Kerala State Drugs and Pharmaceuticals, other IPA colleagues, Mr. P.K. Harikumar, Mr. Dr. John Joseph, Mr. Shantosh TR, and other IPA members here, my dear students, a formal good evening to everyone. I am very happy and it's my privilege that I am part of all your programs, these orientation programs, every year organized by IPA Kerala. It is very fortunate for young students who are sitting here to listen to the visionary leader in pharmaceutical allied industry, Mr. Ajit Singh, whose machines, see, it is not about making quality medicines. India is known for making quality medicines. That is why India is called as pharmacy of the world. he has concentrated on helping Indian pharma industry to make that quality product. Whoever is part of industry will know the brand what Dr. Ajit Singh created, ACG, is meant for quality. We pharma industry people, we rate ACG as a icon of quality compared with any international mission, or even sometimes better than that. And now even most of our USFDA facility who is put in US, they have started buying machines from ACG. So that kind of person has come here just to address all your budding pharmacists. You need to make use of it. Coming back to today's agenda, first and foremost, my appreciation, congratulations to Dr. P. Jayasekar and his team for organizing this every year and motivating or directing or say showing ways to the young students how to enter into industry. We all know pharmacy profession is very noble profession and you have multiple scope, which means apart from industry, you have a lot of scopes in regulatory or I'm talking about government side or as a clinical pharmacist or community pharmacist, any pharmacy fellow, first, if at all you have to ignore your opportunity of starting a pharmacy on your own because pharmacy license PCA is giving to you when you are completing the course. So there is you are by design you are an entrepreneur there, but we are ignoring that and then only entering into other field like going to industry and other things. So you have multiple scope, but IPA Kerala is focusing the students to give orientation towards industry. So today, let me focus something on industry side because the objective of today's meeting is not to tell you scopes in every field, but give you a orientation from industry side. Like the previous speaker said, they have very meticulously planned a lot of modules and a lot of good speakers from the industry to educate the young students. Coming back to colleagues, students, the pharma industry is actually the right industry and definitely you are into the right track, as Mr. Ajit Singh said for himself. Why I am telling like this is, currently, being student, you will be more able to calculate easily than me. See, currently, roughly 57 billion. 1 billion means around 8,500 crores. So, you can just calculate. Indian pharma industry is 57 billion currently means 50% is exports, 50%. I'm telling approximately 50% is domestic, which means and this industry is growing in double digit over more than 20 years. So we are in an industry which is having a strong growth. It is unlike IT industry. If IT industry something comes very fast, iPhone, anything you take, it goes very fast. So the industry is very dynamic, change is very fast. In pharma, you take a product, if a pharmaceutical product is coming, 20 years patent is given only for the monopoly, who is inventing the product. After 20 years, Indian companies like us, all of us are coming in and we are selling for another 20, 30 years, which means a product is having a life cycle of around 40, 50 years. So as young budding pharmacist, when you are choosing your career, you have already chosen a right profession compared with most of the profession, which means what I am trying to record here is pharmaceutical industry or pharmacy profession is a very robust, steady profession compared with most of the other allied professions. Nothing can happen just like that to disrupt this industry. It is a very steady and every year adding your expertise experience is going to reward you more compared with any other field. Now, when I said Indian pharma industry is $57 billion, students, now it is 2025. Another 5 years, that is in 2030, the estimated pharma market is $130 billion. From current 57 or $50 billion, you are going to $130 billion in just 5 years. See the growth. In 2047, the expected market of pharma in India is $457 billion. So you just see, you are a pharmacist. From here, you are beginning your career. And in another 30, 40 years, Indian pharma industry is going to multiply by 5 times every 5 years. No other industry can grow like that. No other sectors can grow like that. So what I'm trying to once again tell here is we are all in right profession. How to make use of the opportunity is the question. And that is why IPA is organizing this kind of interactive session with the various key people in the industry and other R&D and other place, regulatory people, so that as students you can decide where you want to grow, where you want to join and grow. Coming back to pharma industry, as youngsters you should know why even Dr. Ajit Singh mentioned about innovation. For that, you should know the little history of pharma industry. When after Indian independence in 1947, those time India was not self-dependent, it is not independent, and we were dependent on international company. Most of our allopathic medicines were imported. We did not have medicines for all diseases. It is in a bad shape. Most of our disease we were depending on medicines from international community company. It is 1947 to 1970. This was the situation. Hardly very few Indian companies were into pharmaceutical industry, and most of them it was dominated by international companies. And in 1970, the then Prime Minister, Honorable Mrs. Indira Gandhi, and other ministers of that time, they removed the product patent, and they said from 1970 they revisited the patent and said in India we are not controlled by patent. Only process patent can be for 5 years. There will be no product patent. Because of this one law, patent law removal, many Indian companies emerged during 1970. We started manufacturing products, and we are good at chemistry and pharmaceuticals, so we are able to build or develop products. Whatever was launched internationally, we were able to do reverse engineering and launch that product in India. As a result, what happened was that Indian pharma products and Indian pharma industry started growing very fast between 1970 to 1980 and even up to 90. Lot of domestic disease, ciprofloxacin, all fluoxetine, antibiotic, any cardiac drug, anything launched internationally, in another 1 year it was launched in India. So Indian company grew like this. And that time there was no export and it was growing like this. And second important law which changed the entire forum was during 1990, when the Honorable Narasimha Rao was the Prime Minister and Manmohan Singh sir was the Finance Minister, they came of the free trade policy when the Indian gate was opened. Before that, we had restrictions of import and export. Whereas in 1990, when we opened the gate for globalization, our pharma industry made use of that opportunity. Since we were doing almost 10 to 15 years, we did reverse engineering and launched all patented drugs also in India without any patent control. We were self-sufficient. We are trying to achieve self-sufficiency in drug production and able to increase and improve the life expectancy of our Indian people. This all was achieved, and we were progressively growing. When the globalization happened, we started marketing our drugs to international also. We went to every country. Every country we were able to, particularly African countries, during AIDS and other thing, Indian companies literally not sold medicine, it saved life of trillions and trillions of people. The poor Africans and other poor countries could not afford to medicine, they were dying during AIDS, and we given at a very economical cost. As a result, what happened is export grew very fast. Today also our export growth is far better than domestic growth. So today what has happened is India, because of removal of patent and because of this globalization, we could reach over all countries in the world. 200 countries and colonies we reach. Any country in Atlas you touch, there Indian medicine is available. Dear students, IT is very attractive field, but we are exporting to IT information and service. We are doing only over to 95 to 100 countries, English speaking countries. Whereas pharmaceutical medicine is going to all countries, 200 countries. No other service or product is going to this many countries. So we are once again in the right field, remember that. So what has happened is, because of these two laws, Indian companies started growing. Given all products to domestic market and health sector grown and our life expectancy grown, everything was, we are independent and we are not dependent on anybody. A lot of Indian companies become among the top 20, 25 companies in India. Secondly, what happened? We have become the global farmers of the world. This has happened. Well, good, very nice. This contribution happened because of a lot of pharmacists who worked in various pharma industries and made India proud like this. Now, in 2005, the big change came. International people put a lot of pressure on us, and as a result, we are once again went into the patent era. That we cannot do products like this because they are investing a lot of money and bringing a new drug, and you are just copying and selling all over the world. It's not allowed. This way, they have put pressure on us, and as a result, we are no part of patent. No way we can remove patent henceforth. So what Dr. Ajit Singh now, if you connect what he said about innovation, that is very, very important, dear students. 2005 onwards, now we are all part of patent era. Any drug which is invented, any molecule invented, any new usage you invent, you will be protected with patent from minimum 5 years to maximum 20 years. And just for your comparison, I think most of you know a company called LA Lilly. Okay, see they were in ranking in 12th or 13th rank 5-6 years before. Today they have become number one, and you know they have brought only one group of drug for obesity and diabetes called triceptide. I think most of you know Mounjaro and Zepbound is their brand name. What happened is one drug for weight loss and diabetes they invented and brought in. Now their market cap, their market value is $700 billion, one company. Whereas lot of other companies like 5 top companies, Bayer, Merck, Bristol Myers, Pfizer, Johnson Johnson, put together they are only $690 billion market cap. What I'm trying to tell is one product, one innovation. Our Indian pharma market put together 3,000 drugs with so many 10,000 companies with exports, equal quantity of exports. Our value is $55 billion. One molecule, because of one molecule, the market cap of a company is $700 billion. This is the power of innovation. Why I am touching this is, friends, even Jaisekhar sir said, everybody said, Kerala, there is not much industry. No, I don't think like that. If at all innovation comes, it can come only from Kerala. Please understand, why I am telling that is, most of the pharmaceutical drugs, what we are currently using is from plant origin. When I told in the early 1947 to 1970, we hardly had any Indian industry, we were depending on multinations. Most of the multinations derived products from phytochemistry, from Ayurveda and Siddha. They were stationed in India and they did a lot of research and taking the active principle from the plant origin, and they made drugs. Most of the drugs, even statins came from a fungal mode only. Most of the drugs were from plant origin, and they were blockbusters and they innovated drugs. If at all, who is better, which state is better for Siddha or Ayurveda or anything? South state, particularly Kerala, where still you are practicing, your good knowledge is there on Ayurveda, Siddha, natural medicine. If at all any new innovation comes, it can first come from Kerala. So what I'm telling is, who can invent a drug? Who can bring a molecule from a phytochemistry or from a plant origin or anything? Only 90% chance is only there for pharmacists. So I think the scope, you should not think as just, your dream should not be just going and working as a manufacturing chemist or a medical representative industry. That all is will helpful to start your career. You should think the scope of innovation is available for you. And all big scholars are from Kerala. So what I'm trying to tell is, one drug, if you bring only one person or one team can bring one drug, you can identify or take active principle from plant origin and make it as a, you can take it to market. The entire pharma industry, our 57 billion, you can add another 100 billion in one product. That is the scope of patent. 20 years monopoly. So my request is, concentrate on innovation research, which is very much available in Kerala. Similarly, pharmaceutical industry growth, equally nutraceutical growth is there. Today, nutraceutical is expected in 2040 or 2035. Nutraceutical sale will be more than pharmaceutical. Even in India today, it is like that. So once again, Kerala can play a very big role in bringing nutraceutical products. Above all, in the Indian state, Kerala is one of the top 3 in medical devices. So medical devices also pharmacies are having very good scope. Why I am talking is Kerala is a place for intellectual people, like Ajit Singh sir said, hardworking, sincere, innovative. You have a lot of environment for concentrating on the innovation in nutraceuticals, innovation in formulation, innovation in phytochemistry or natural drugs or from allopathy can be derived, innovations in medical device. All these opportunities are available. Okay, how to explore it? Explore it with the opportunity. Decide when you are in the third year end or before starting your final year. You need to decide where you want to go. Suppose you want to start in industry, friends. I can very fast tell you, if you want to go to job in industry with only B Farm, not studying M.Pharm or PhD, only B Farm means you can go into production, little bit in QC, and you can go as a medical representative, marketing. These are all opportunities. Suppose if you want to go into R&D, formulation development or analytical development, you need M.Pharm Sutix for formulation development, M.Pharm analysis or chemistry for analytical research. And of course, if you want to go into QA and RA, we are preferring M.Pharm analysis or M.Pharm QA, M.Pharm RA, who we generally prefer M.Pharm. If you want to go into product department in marketing, so B Farm with MBA, M Farm with MBA, you can very well grow very fast and go as the vice president also. So if you want to go into basic research, what I said, innovations from plant or biotech, any route, then PhD is better. So what I'm trying to convey here is, based on your idea, the scope is too much scope is there, not one scope. If it is only one, suppose a civil engineer is there, he is going to construct. The route is very clear, only civil engineer. Okay, go and work in a civil company or you start. Whereas pharmacy, unfortunately or fortunately, you have more than 25 scopes minimum in the industry side. So my point of view here is, you need to decide when you are in third year end or final year before where you want to go. Based on that, you have to decide whether you will continue B Farm and go to job, or you will go into MBA, or B Farm after that you will go into biotech side, or you will go into M Farm or PhD. These all will be decided. You should decide and take the help of your seniors, professors, industry veterans, and people like Dr. P. Jayasekar and others. We are here to help you. From the IPA, what is the benefit of IPA? IPA is the body which can help, which has everybody into it. Regulators, industry, teachers, all are there. So we are here to help you. My request is, this is a very good opportunity. You have this orientation of industry is a very good opportunity. I think all the pharmacy students would have come into it, but I'm happy over 100, 120 people are there. So please make use of it. Any support in terms of industry, always IPA branch is contacting IDMA in Tamil Nadu. Everywhere we are trying to help you. Don't worry about, don't have short aims, small aim of going and working in a company. Think big. Try to build your career. Don't try to build your job. That is not helpful. And you are a person who shown ways to the rest of the states. If you take most of the abroad, Kerala people are there. Most of the marketing heads, innovative people, people from Kerala only is there. They will be sitting in Bombay, but they are from Kerala. So what I'm trying to tell is, the opportunity is tremendous. Think big, and you are very well posed, very well. You have an environment in natural medicines, bringing into allopathy, medical device, etc., etc. So what I'm trying to tell is, make use of this opportunity like this, what IPA was arranged, and I'm sure you can come up with flying colors. With this, I wish all the students who are attending here for best of their career, all the best to you. Thanks for the opportunity once again to IPA Kerala State. Thank you.
Thank you, Jayashree sir. Your speech gave us an explicit idea about Indian pharmaceutical industry of yesterday and today. I believe that the pharmaceutical industry aspirants from Kerala can really look forward taking the message from Sir's speech. Like, they can just explore the fields of nutraceuticals like pharmaceutical devices and other new innovative fields. Then, so this, what I will tell them how to plan your career. So taking the words from Jaiseelan sir, think big and achieve your goal. Thank you so much, sir, for your informative speech. So now, we are pleased to have with us Mr. K.P. Purushothaman, President, Kerala Pharmaceutical Manufacturers Association, KPMA Director, Director of Chetana Pharmaceuticals Private Limited, to have a felicitation for us. Over to you, sir.
Good evening to all of you. Am I audible?
Yes, sir.
Dr. Jayashekhar, President IPA, Dr. Ajit Singh, Mr. Jayashilan, and dear students. I'm thankful to IPA for inviting me to this program. And I should say that IPA has always been a bridge between the pharma industry in Kerala and the students for their upliftment. Thank you, IPA. Now, I'm thankful for IPA for their efforts in conducting these orientation programs for the students and making them ready for the industry by the time they pass out. Now, my best wishes to the students and wishing the program all success. Thank you.
Thank you, sir.
Thank you, sir. So, we do have some students with us who have finished the hands-on training in industries, and we will hear the reflections from them. So now I request Mr. Vaishak Vivi, the B.Pharm final year student of Mar Dioscorus College of Pharmacy, Tirunelveli, give a few words about your training.
Thank you, Lily Madam. Am I audible?
Sure, sure.
Okay. I hope you all are doing well. Happy Eid Mubarak to all. It's a pleasure to be here with you today. I am Vishak Vivi, final year B.Pharm student of Mar Dioscorus College of Pharmacy, and I feel truly grateful for the opportunity to share my experience at Microlabs Veerasandra plant, Bangalore. During my internship at Microlabs, I had the opportunity to gain valuable hands-on experience in the pharmaceutical industry. I was assigned to the quality control department where I learned about various analytical techniques such as HPLC, UV spectroscopy, dissolution testing, etc. Under the guidance of experienced personalities, I participated in routine lab work, documentation process, production process, and stability testing, etc. This experience not only enhanced my technical skills, but also gave me a better understanding of industry standards and regulatory requirements like GMP and GLP. I also had the chance to attend team meetings and interact with professionals from different departments, which broadened my perspectives on how cross-functional teams work in a real-world settings. I would like to sincerely thank the Indian Pharmaceutical Association for providing me with the valuable opportunity to attend an internship in the pharmaceutical industry. This experience has been extremely enriching and has significantly contributed to my professional and personal growth. I am truly grateful for the support, guidance, and platform that IPA offers to students like me to explore real world industry practices. Thank you once again for this wonderful opportunity. Thank you.
സാർ എത്തിയിട്ടുണ്ട്. Dr. Julie.
Thank you, Mr. Vaishak, for your
Thank you, ma'am.
reflections on hands-on training. Now it is the time for inaugural ceremony to orientation.
Madam, let Steffi talk.
Okay, fine, sir. Okay, we do have one more student aspirant, Ms. Steffi Pramod. She is from Al Shifa College of Pharmacy, Perindalmana. So, Steffi, you can share your reflections. Steffi, can you hear?
If you can unmute. Hello.
Steffi, can you hear us?
Yes.
I think she's not available.
Not available. Maybe got disconnected. Let us go to inaugural session now. Madam.
Okay, sir. So, shall we go with that?
Good evening, sir. Dr. Mohammed Kullamed, sir. Did you join?
Good evening. Good evening. Good evening.
Okay, sir. Thank you, sir.
Okay. Okay, so it is now time for the official inauguration of OPA 2025 Orientation to Pharma Industry, a flagship initiative of Indian Pharmaceutical Association Kerala State Branch, designed to bridge the gap between pharmaceutical education and industry expectations. We are deeply honored to have with us Professor Dr. Mohanan Kundumal, Vice Chancellor of Kerala University of Health Sciences, Thrissur, a distinguished medical academician, visionary administrator, and a nationally respected leader in health sciences to inaugurate this important program. Dr. Kundumal currently serves as the Vice Chancellor of both Kerala University of Health Sciences and University of Kerala. An alumnus of Government Medical College, Trivandrum, he brings over 25 years of academic and clinical excellence in radio diagnosis, including a decade as professor and head of department at Government Medical College, Thrissur. His leadership has transformed several medical institutions into centers of excellence. He has held key roles such as Principal of Government Medical Colleges in Mancheri and Thrissur, Dean of Faculty of Medicine, and Senate member. At the national and international levels, Dr. Kundumal has contributed significantly, serving as the President of Association of Indian Health Sciences Universities, National President of Indian Radiological and Imaging Association, and Executive Councillor of Asian Oceanic Society of Radiology. He is also a member of Radiological Society of North America and European Society of Radiology. During the COVID-19 pandemic, his expertise was sought by Government of Kerala as a special invitee to State Advisory Committee. His many accolades include Best Doctor Award from Government of Kerala, the IMA Community Service Award, and Dr. P.J. Alexander Memorial Oration Award. He has guided 19 research projects and has numerous national and international publications to his credit. We are truly privileged to have such a highly accomplished and respected leader to inaugurate OPA 2025. May I now invite Professor Dr. Mohanan Kundumal to deliver the inaugural address. Over to you, sir.
Good evening. I'm extremely happy to be with the Indian Pharmaceutical Association and this wonderful program. In fact, as a person who inaugurates, I will be talking to you in the initial phase and very often will not listen what will happen subsequently. But today, because of various circumstances, I got an opportunity to listen the entire session, and it was a great learning experience for me. So, Dr. P. Jayasekaran, Dr. Ajit Singh, Dr. Jayseelan, everyone was speaking about the amazing growth that the Indian pharmaceutical industry is achieving. And in such an exciting time, where are our students? What is the future for them? So it's very simple for me to say that it is just to connect the students with the booming Indian pharmaceutical industry. So that's very simple. And that is exactly what the association is doing. We know that India is going to be the #1 drug manufacturer in the whole world. In fact, in the generic medicines, by volume, we are the #1. And 50% of the vaccines the world uses comes from India. And 80% of the antiretroviral diseases, the drugs, antiretroviral disease drugs, it also comes from India. So such a huge potential we have. And very often the students in our colleges were not getting sufficient exposure to the industry and what is seen all around. But now, for the last 2-3 years, the association has done a great job in connecting the students with the industry. And my hope is that, of course, these students will get opportunity to go out and work in various industrial units outside the state. Why not we start industrial units, more and more industrial units in Kerala? We have industrial units. Probably one of the earliest industrial unit in the government sector was started by Government of Kerala, KSDPL. Now it is getting revived. But why not we have small industries in all our colleges? Now the Industry Academy Connect is being discussed, and also in most of the universities, the industrial parks, the science park, IT park, these are all coming up. So we must have pharmaceutical parks in our pharmacy colleges. We must have an independent pharmaceutical park like the Techno Park. We must have in the state. And also we must have a lot of research opportunities wherein the university can do a lot of help. For example, as it has been said that Kerala has got a rich tradition in Ayurveda and a lot of Ayurvedic formulations are available. But a lot of research can be done in that area, and maybe we can get some new molecules which can change the entire course of pharmaceutical industry in the state, in the country. And the Ayurveda Research Unit at Tripunitara by the Kerala University of Health Sciences is doing a lot of work, and we can have a combined research program with the Center, School of Fundamental Research in Ayurveda at along with stalwarts in the pharmaceutical industry as well as in the pharmaceutical scientific fraternity. So all these things are very much possible, and I'm so happy that I could be here with all of you. I was traveling in between, that's why But however, I was listening to the entire conversations, and all these conversations were quite educational for me, and it definitely must have been educational for all our students. And I know that not all students are here. University also will help the association, so that let us together have a program so that what has been said by the eminent professionals in the industry should reach each and every student. They must be proud of our pharmaceutical industry. We must be proud of our strength in the pharmacy. And we must be proud that if a person in America or Africa gets a disease, India is there. Vice versa, if India is not there, they are going to suffer. So that's a message we must tell our students how strong we are. This is the message we should tell. And with these words, I declare that this series of programs inaugurated. Thank you very much. Sarve Bhavandu Sukhina. Namaste.
Thank you very much, Professor Dr. Mohanan Kundumal, for your inspiring and great inaugural address. Your words have set a thoughtful and visionary tone for OPI 2025. We are truly grateful for your presence in spite of your busy schedule and for sharing your valuable insights on evolving role of health sciences and importance of bridging academic learning, research with industrial practice. Thank you very much, sir. So now we have Ms. Steffi Pramod to deliver her reflections on hands-on training.
Good evening everyone. I sincerely apologize for joining late. I had unexpected network issues. Okay, now I will present. So good evening everyone. I am Steffi Pramod and I truly grateful to have been given this opportunity to speak here today. And I sincerely thank Indian Pharmaceutical Association for giving creating such platform for young professionals like me. And it's really encouraging to be part of an event that bridges students with industry. And I consider it as a great privilege. And recently, I had a chance to gain hands-on industrial experience at Mylan Laboratories, Hosur, and it was a turning point in my academic journey. Until then, most of my learnings was limited to classroom and textbook knowledge. And being inside in real pharma industry, I can able to understand how industry functions in day-to-day basis. And during my time at Mylan, I got chance to see all the departments like manufacturing, quality assurance, quality control, packaging, etc. And it was quite interesting to learn how all these departments work together to ensure the medicines we use are safe and effective. And I was really impressed by how carefully they are following rules and kept all things cleaned and record each step properly. And this experience helped me to connect the things I have learned in classroom with how things actually happens in industry. And it also made me more excited to work in pharmaceutical field in future. And I am truly thankful to IPA and my colleges for giving the chance to experience it and learn so much. So thank you once again. Thank you.
Thank you, Ms. Steffi. And to express our sincere gratitude to all who made this event a success, I now invite Mr. Achu Mohan, Deputy Production Manager, KSTP Limited, Alappuzha, to deliver the vote of thanks. Over to you, sir.
Hello.
Achu Mohan, sir.
Hello. Am I audible?
Yes, sir.
Yeah. Good evening to one and all. It's my privilege to honor to deliver the vote of thanks on this special occasion, the formal inauguration of our webinar series, Orientation to Pharmaceutical. First and foremost, we would expect the heartfelt gratitude to our esteemed teachers, the Honorable Vice Chancellor of Kerala University of Health Science, who has for graciously accepting our invitation and inaugurating the event. We are equally grateful to our other guests of honor, Mr. Ajit Singh. Thank you, sir, for your presence and valuable insights you have shared. And Mr. Jay Sheelan, a distinguished leader of IDMA, Chennai, for your participation and added great value to our today's program. We sincerely thank each one of you for taking the time from your busy schedule to take a session note for the appreciation goes to the organization committee, especially Dr. Jaishankar sir, coordinators and technical team who have worked tirelessly behind the scenes to ensure the conduct of this class. We also thank our attendees, the students, faculty, and industry professionals for
Yes, sir, it is audible.
from various corners to the Zoom platform. We run this enthusiastic class participation is as we move ahead with the webinar series. Let's carry forward the insights and inspirations shared together that continue bridging the gap between the academia and the pharmaceutical industry. Once again, thank you for making this inauguration a resounding success. Stay safe and stay inspired. Thank you.
Thank you, sir. As we conclude today's inaugural ceremony, let us rise and pay tribute to our nation by joining the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thank you all once again for joining us for inaugural session of 4th Orientation to Pharma Industry OPA 2025. Your presence and active participation have made this evening truly meaningful. This initiative is more than a program, it is a movement towards stronger academia-industry collaboration. Over the next sessions, participants will engage with leaders, explore real-world practices, and gain valuable hands-on exposure. We invite you all to actively participate in the upcoming webinar series and hands-on training and make the most of this opportunity to transform learning into practice. Wishing you all the productive and enriching experience ahead. Have a pleasant evening to you all once again. Thank you.
Thank you all. Thank you.
Thank you. Thank you.
Thank you. Thank you. Good night.
Thank you. Thank you very much.
Thank you very much.
Hari Kumar sir, good evening.
Thank you. Thank you. Good night.
Good evening. Santosh. Will do. Okay, bye bye. See you. Thank you.
Thank you. Thank you. Thank you, sir. Thank you.